Hello, Assalamu alaikum, and welcome to Salam Media. You're listening to the Ruwa Shah Show. You can watch our broadcast on our Facebook page and on our YouTube pages. Both India and Pakistan have relaxed the lockdown restrictions after at least 3 months since the outbreak of the pandemic. But the COVID 19 cases have taken a sharp jump. India has been registering record figures every day for past 1 week, while the cases have soared in Pakistan as well. That raises an important question here. Was easing the restrictions or the lockdown at this time a right option when the cases are surging up? Or was lifting the lockdown necessary to revive the economy that has taken a hit severely? To discuss this in detail with us, we have Dr. Anand Ban. He is a researcher in global health, bioethics, and health policy. He is based in Bhopal. And we have Dr. Anand with us, and he'll be joining us in about a second now. Welcome to my show, Dr. Anand. Thank you for joining me.
Thank you for having me, Ruwa.
Dr. Anand, India imposed a lockdown at a time when there were not many cases of coronavirus, but when the cases have gone exponentially high, the government has lifted the curfew, sort of. What do you think could have possibly gone behind this decision? Will the lifting of this lockdown lead to more cases?
Yeah, so as you were rightly pointing out, I think the Indian government decided to impose a lockdown pretty early in the spread of the pandemic, and that was around when we had around a case count of I think around 500. And I think it was partly probably driven by concerns around how other countries at that point of time were facing the brunt. So many countries like Iran, Italy, Spain, etc., were starting to have a lot of crises in terms of the numbers, and it was taxing the health system. So I think it was sort of probably seen as a preventive step which was required. It was also the largest lockdown in the world in terms of the number of people who were directly impacted. And as we have realized that now, more than 2 months later, there is a time where there has been a lot of negative impact because of the lockdown, primarily economic in nature. There was a lot of economic migrants who traveled across the country, which became a sort of a humanitarian issue as
Right.
well. So I think it became clear that the lockdown, while it was useful in slowing down the spread of infection, was not never going to stop it completely. And now we've started to see that that spread of infection is, instead of being located only in a few places, is actually now almost nationally spread out. The drivers of infection are still largely the cities. So, as you know, Delhi, Mumbai, and a couple of other cities are where the bulk of the infections are. But having said that, there is almost no state left where there isn't an infection now, or there is not a cluster of infection. So now with this national spread and the fact that we've now been in a very long extended lockdown, I think the decision has been taken that it's probably time to slowly start opening up. So for some people look at it as lockdown 5.0, some people call it unlock 1.0. So it depends on how you see it, but it's clearly the case that we have to start seeing some kind of a graduated lifting of restrictions. Now, how they do it is going to be an important question. And is that something which is done as a one size fits all strategy versus something which is more localized in nature?
So
Because there are
help me
states.
understand this. You're trying to say that the lockdown needs to be lifted in some ways because the economy has been badly hit. But medically, when you talk about this virus, this pathogen, there is no cure. So the only cure is that you have to stay home and try not to get infected by this virus. How are both these things going to be balanced by countries, developing countries, particularly like India itself?
Yeah, so I think that that's the challenge, right? You cannot always have just people cooped up at home. How long can you keep doing that? Because as you were pointing out, the vaccine is a bit of a while away, right? It might take more than a year for us to get there. We also don't have an effective drug regimen yet. There are a lot of promising candidates being tried out, a lot of repurposed drugs. So till we get there, we need to live with the virus, right? And
Right.
in that sense, have ensure that our health system and our health facilities are not overwhelmed in any way. One way to do that is to have a lockdown, but then as we have seen in many countries, including India, lockdowns are not 100% effective. Now, if lockdowns were to work, then we would have never had a rising case count. So,
Right.
lockdowns have some utility. It can slow down the spread of infection, but it's not going to completely stop it. Lockdowns are also they are a means to an end. They are not an end by itself, which is to say that you have to use the lockdown effectively to increase your testing, increase the capacity of your health system, get your contact tracing in place, ensure that you do more public education. Because as you again said, the only thing we know which works is public health measures like physical distancing, like ensuring that people wash their hands frequently, usage of masks, ensuring that those who are most vulnerable are kept protected in some way, right? So we need to keep reinforcing that. But is the lockdown by itself, if you keep extending it, is probably going to have a lot of negative ramifications, some of which we have already seen. So I think it probably makes sense to start talking about how do we need to increase the liberties that we provide so that more and more people are able to, for example, go and start working to some extent, that we have some services which get started. But how do we do it is the question mark. So for example, opening up religious institutions, should that be the priority? Because I know that is something which a lot of public health experts have raised concerns around. What is the right strategy in terms of public transport? When should that be started? Schools and colleges, should that be a priority or not, and for what reasons? So what decisions you make about unlocking are also important, and what again, what kind of public health impact that might have needs to be studied.
Right,
So I
Dr.
think
Baum,
it's
countries,
not, yeah.
European countries, including Turkey, has been really effective in managing both the lockdown and flattening the curve, what we call as. Why can't a similar model be, why can't the same model be used in countries like India? Is it because of the population, or is the government not so efficient in terms
Yeah,
of?
so sure. So I think, as you know, in some parts of the country, things have been relatively better. So down south in Kerala, we've had relative good success. Karnataka has been doing well. The northeastern states are doing very well compared to the rest of the country. So it's not to say that across the board we are not seeing some kind of positive progress. And parts of the country where there is strong social cohesion, where there is a trust in the government, where there is a strong health system which is built in, where there are community health services, where there is a support for individuals who need to be isolated or quarantined, etc. I think we're starting to see good results. The challenge, I think, is in high density population areas like Delhi and Mumbai, where the measures are clearly not enough, and they might have been, the spread of infection might actually be already in the communities. So
Mm,
controlling is going to be much more difficult. So I think
right.
that is where, and now also with travel being allowed, I think that infection is also spreading with migrants as they go back, because many of them might have mild symptoms or they might be asymptomatic, and when they go back, they take this infection back to rural areas. And the other challenge is that rural health systems are much weaker than our urban health systems, and
I was
there
going
are
to
less.
come
There
to
is
the health systems, Dr. Ban. There are hundreds of doctors who have been tested positive and other healthcare workers. How effective is the healthcare system? Because, the last 3 months was sort of a time period that was given to all the countries to place the lockdown and improve your system or work on your healthcare care system, maybe manufacture more ventilators or hospitals or isolation wards. Was this time correctly utilized by the government in India?
Yeah, so again, that I think is variable. I think across the board, governments did try, but a lot of focus was probably done on getting your number of beds ready, and your, in some cases, oxygenated beds, in some cases, ventilators. But I think the challenge has also been that, there is no guarantee that whatever eventuality you prepare for, it might not go beyond that. So, any estimate that we are seeing is based on modeling, and models can only be so much effective, right? So if a model says that, for example, we might have 75,000 cases in a particular city, you can prepare for that in terms of having your hospital beds accordingly set up. What if it goes beyond? Will you be able to
Right.
cater to the health needs then? The second issue is, the easy part is getting the infrastructure in, which is the beds and the ventilators. But how do you get your staff in? Because as your requirement for beds and care increases, then you will also need more staff to be able to man those beds, those ventilators, etc. And that's all specialized here. So, do we have enough healthcare personnel available? Do we have backup staff available? what happens if some of them get infected, as you were pointing out, and then obviously go off duty, then you have replacement available in a way that you can provide effective 24 into 7 care for those who need it. So I think that's really the challenge now, is that not just beds, but do we really have human resources to support all of that infrastructure? The other element, I think, is now with monsoon season setting in South Asia or in most parts of South Asia, the requirements for non-COVID-19 care are also going to go up. So other diseases like dengue, malaria, waterborne infections also start increasing at this time of the year. And that will mean that you cannot only assume that every care requirement is only COVID-19 in nature. You will also have to prepare for all of those non-COVID-19 requirements as well, and that is not going to lessen. So assuming that everything can be focused on COVID-19, yes, you can do that maybe for the very short term. But now that we know that we have to live with the virus for a while, it's good to also keep in mind that it's not just COVID-19 patients who require care, but those who might require dialysis, cancer care, immunization, pregnancy care, other viral infections which might spread. So in that sense, again, it clearly shows that a health system which is more well resourced, more well prepared, will probably do better. So again, since in your original question was how as a country is India faring? So I think it's pretty variable. It depends on the state, and those states which have invested more in their health systems historically, I think, are doing better. Those health systems where there is more staffing available, good systems both from primary, secondary, tertiary level are doing relatively better. And the other states where there have been challenges, I think, are struggling, and they will struggle more as the
Right.
number of cases.
Does this have something to do with the population? Delhi is most hit, and Mumbai, as you mentioned, is most hit. Even the Delhi Chief Minister Arvind Kejriwal was tested today, but he tested negative, as I believe. So there is a huge surge in the number of cases in those cities. Is it something to do with the ease in restrictions, or is the population too much to be controlled?
Yeah, so I think initially the cases were probably more in the middle class and maybe the relatively more well-to-do families, which which travel internationally brought in the infection. But now the infection has spread across the board. So a lot of the infections now probably are in lower income communities, and these are communities which might live in areas like urban slums, high population density, difficult to ensure physical distancing, because for example you might have many family members staying in one room. You might
Right.
have common toilets for the entire community. You might have a water supply which is common in nature, and is only supplied, say, maybe once or twice a day, so people have to go and collect that water, etc. So all of those become then risk factors for the spread of infection. And as that infection spread is continuing, and you don't have and the health system is struggling under that, so you have certainly a case where there's spread of infection. Now these same individuals are then now traveling back. Many of them traveled back to their hometowns where they came in from, right? Because Delhi and Mumbai are also economic centers. So those families which who did not have any work during the lockdown, many of them wanted to go back home, and some of them have taken back the infection with them. So yes, Delhi, Mumbai, Indore, many of the larger cities are seeing a lot of infections. But my concern now is that moving forward, as the infection travels to rural areas, will we be able to face a rising surge in these areas, and what are we doing
The
to prepare
coming
for that?
weeks seem to be very challenging for the government, the healthcare workers, and everybody, right? Can India adopt a smart governance system like food delivery system, or community based service in the rural areas? Is there a possibility that such a model can be applied as of now in these situations?
Yeah, I mean, I guess again, something which is more localized in nature, which is driven by local data, is also supported by local communities, has a higher likelihood of being effective. Kerala has done that. They have a strong local support system which is built in. Anyone who's isolated at home is provided support by the government. They get ration, they get food resources, etc., delivered at home in a way which enables them to be able to stay at home and not have to venture out. So, I mean, that's the kind of support you need to build in. The other thing is what kind of mechanisms for contact tracing, for prevention, messaging, for supporting travel and transport of those cases who might be potentially infected, need to be tested. or might need to be isolated or be put into health facilities? Do we have those available in such a way? Because the more people who are infected are just rushing around from one center to the other trying to get tested or trying to get admitted, they are probably also spreading infection with them. So it's in the best interest of both those individuals, the communities they belong to, as well as the health system, that we make that system more simpler so that you minimize the spread of infection.
Right, Dr. Ban, talking about the efficiency of medicines that are already in use to ease the symptoms of this virus. Hydroxychloroquine was one of the most talked about drugs in this time, and Indian government recently issued an advisory to expand the search and experimenting and testing about this. What is your view about this?
Yeah, so hydroxychloroquine is a drug which has been around for a long time. It's also off patent, which means that it's also a cheaper drug, mass produced. It's been used as an anti-malarial. It's also been used in in some other inflammatory conditions. It's got a decent safety profile. There are side effects attached to it. So the key question here is, if we are using it, I mean, there's sort of two uses now within COVID-19. One is as a prophylactic, which is as a preventive medication to prevent someone from getting the infection. And there is, scanty evidence about that, a lot of questions around the evidence that exists. And the second thing is trying it out in those who have already infected. So, actually trying it as a treatment of some kind or as a supportive treatment of some kind. Now, on both of these, there is the evidence is a mixed bag. There have been many studies which have come out which show that there doesn't seem to be much impact, but there are other people who are detracting from that and saying that might be partly that data. There is still some data which is supportive of it. It is relatively not as good quality wise because it might be observational or case control studies versus a randomized control trial. But I think the larger question which many of us have raised is that, do we have enough evidence to push that as a prophylactic? Because right now, as you were saying, there's an expanded advisory which came in, and many of us are uncomfortable because we don't really have definitive data that it works. So people might be consuming it in the hope that it works, but in the
Mhm.
absence of that data, it might either give a false sense of protection, or it could potentially also lead to some side effects given the number of people who are taking it. And do we have mechanisms in place to identify those side effects, quickly identify these individuals and provide care is also a question mark. So I think the good thing to do would be, or the ideal thing to do would be, to actually suspend that advisory, gather good
Mhm.
quality RCT level data, and if it actually is effective as a prophylactic, all the more reason to use it, but then based on evidence, not currently in with the lack of evidence,
There is a
because
lack of
then
evidence. There were
one it
theories,
might be.
Dr. Ban. Yeah, please continue. Please go ahead.
No, I was just going to say, because in the lack of that, we are just probably giving mass prophylaxis to a lot of people, but then it might not really be working. And we
Right.
have, because there
Also,
is.
there were theories, Dr. Ban, that initially there was not, number of cases as were seen in countries like Italy, Iran, or the United States. It was not as scary as it was in those countries in India, particularly. So there was a theory that the medication that is already in use by the people of India has kind of, given us a inbuilt immunity against this virus. How true or not true was that, and did it help give us time to build our infrastructure against to fight this virus?
Yeah, so I don't think that was probably a reason. I mean, if any, we will find out in the near future as people are gathering evidence. I think it was more likely that the lockdown slowed down the spread of infection, because the lockdown, as we discussed earlier, was imposed pretty early. But it was probably not, medication which a lot of people were taking. Because again, these are
Right.
medications now. It's not true as of that the entire population takes them. It's only a subsection of the population. So anything which is being proposed in terms of, it might be linked to BCG vaccine,
Right.
might be linked to usage of anti-malarials, etc. I think so far has been discounted. There is no clear evidence which is supportive of that. There is a lot of theories, but those are hypotheses which need to be proven. So I think right now the only thing which works is public health measures. So let's just focus on those, because we know that those work, and for healthcare workers, especially, good quality PPE as well, besides the public health measures.
Right, Dr. Ban. So you seem to say that the worst is yet to come. I believe that's what the crux of it was. And how do you see, amid all this, how do you see the coronavirus being contained in near future in India? Can it be contained, or can the curve be flattened at all?
So I think what we need to prepare for is probably a situation where the virus is going to be around for a while. Where will there be one peak? Where will there be multiple peaks? We don't really know. There are various modeling estimates which say there will be a peak in July. Someone says it will be one in August. Others will talk about a later peak. So I think what is more probable is to prepare for a situation where there might be more infections, where it might be more discreetly spread, and then accordingly prepare for it. I think trying to focus on getting the health system and more beds and all is good, but more importantly, you not need to talk on prevention, because what you want to prevent is a situation where there are too many patients and no beds available or no staff available to be able to treat them. We have already seen some cases like that in cities like Delhi and Mumbai, and that is not what you want to happen to anyone, right? You don't want a patient who is needy and is not able to access health services. So the way to prevent that is to actually keep reinforcing your public health measures, ensuring that you minimize the spread of infection, and you try to keep your case count low enough that the health system is able to manage. So in a way, it would be ensuring that, even if there are cases, because you might not be able to prevent every case, you keep them low enough that your health system is able to cope up till we get a vaccine or to a drug. If there are models which seem to work in certain parts of the country, then we should be looking at. If there are models which have worked in other countries, then we see what we can adapt and then focus down and use those measures. Now that we know that lockdown is a permanent solution, then what is the new way of handling things, the new way of living that all of us can prepare for and embody, right? So using
Right.
masks, for example, ensuring that we are careful when going into public spaces, into crowded spaces, that we take individual responsibility, but also the role of the government in enabling that is important.
Right, lockdown is not the permanent solution. Thank you so much, Dr. Pan, for joining us. It was really informative, and we hope to have you again sometime on our show. It was a great
Thank you.
discussion. Thank you for being with us.
Thank you for
With
having
that,
me. Take care.
we take a break, and we'll be back with another expert from Pakistan who will be informing us about how the lockdown has been eased and how is it changing the situation in Pakistan. Please be with us. Keep watching Salam Media. Thank you so much.
He faced a pandemic like the COVID-19 virus.
The World Health Organization has declared the coronavirus outbreak as a global pandemic.
Penny Appeal believes in prevention being the cure, and we remain firm in standing by our commitment to support and help those in need.
Because the border have closed, are very, very affected. So
they are lacking in the supplies.
I hope government can find a solution.
Our response is to provide hardship grants to those experiencing a loss in income in the months to come, and hygiene kits for the vulnerable at home here in South Africa and Syria and Palestine. Show compassion in the midst of crisis. Donate to our coronavirus emergency appeal now. Be proactive. Be aware. Help save a life. Donate today. Call 031 1100 573 or donate via www.pennyappeal.org.za. Penny Appeal. Small change, big difference.
You may be out there in the working space building your future. Perhaps you are as comfortable on the sports field as you are in the boardroom, or hard at work being the best student possible. You could be spending most of your time at home grooming the leaders of tomorrow. Either way, you need to feel confident, strong, and comfortable. Eternity Sanitary Pads, now available at a store close to you.
With Delight's range of cooking oil, spreads, rice, and mace meal, you'll be dishing out the most delightful dishes every day. Delight. Try it today. Delight is delightful.
Listen to something fresh. Listen to Salam Media, your humanitarian broadcaster.
Hello and welcome back. You're listening and watching the Ruwa Shah Show, and you can listen and watch our broadcast on our Facebook and YouTube pages. We're talking about the situation of the coronavirus pandemic across India and Pakistan. We had an expert, a doctor from India, who informed us about how the ease in restrictions and lockdown in India has led to the surge in the number of cases. Now we have with us Dr. Rad from Pakistan, and I hope yes. Assalamu alaikum, Dr. Raad Asad, and thank you so much for joining us. We cannot hear you. Can you please unmute your mic if you can? We can't hear you. All right. Meanwhile, we get back Dr. Raad. So, both India and Pakistan have relaxed the lockdown restrictions after at least 3 months since the outbreak of the virus, but the cases have taken a sharp jump in both the countries. India has been registering a lot of cases, and so has Pakistan. Dr. Raad, can you hear me? I still seem to not hear you. All right, we're trying to get Dr. Raad with us online. Meanwhile, Dr. Anand Ban was with us, and he was informing us about how the Indian government has been trying to be efficiently deal with the situation, but he was also suggesting that the governments can take examples of other countries that have been successfully able to flatten the curve to some extent. And he was also telling us how the season of other infections is near, as it's monsoon time in India, and it can lead to a very disastrous situation. So they need to be more careful in managing the situation. Meanwhile, we're trying to get Dr. Raad with us. There seems to be an issue with the mic. The situation in Pakistan has also been worsened after the lockdown restrictions have eased. The curfew has not been completely lifted, but the markets are opening, people are coming out, the malls have been opened, and people are going out and opening. Assalamu alaikum, Dr. Raad. No, I still do not get your voice. I think there is some problem. We might try to we can try and call you, Dr. Raad, maybe. If we can call Dr. Raad directly and see if we can get him. Meanwhile, while we get Dr. Raad, we will take a short break and we'll get back. Please keep listening and watching us on our Facebook and YouTube pages and on our broadcast on Salam Media's radio broadcast. Thank you so much.
It's a new beginning. It's a new era. Salam Media, humanitarian journalism.
Not trying to be in there, not trying to be cool, just trying to be in this room. Robbie, you know too. I can feel where the wind is, I can feel it through all of the windows inside this room. Yeah. But I cannot touch you, Robbie. I wanna feel you too. I wanna see the sunrise and my sins just forgive me. Light it up, oh my love, I'll be up tonight. Wanna make it up for all my wrongs I tried. Never let me be alone. Stay with me from dusk till dawn. Stay with me from dusk till dawn. Robbie, you're right, yeah. I'll hold you when things go wrong. Stay with me from dusk till dawn. Stay with me from dusk till dawn. Robbie, you're right. Stay with me from dusk till dawn. Robbie, you right. My door's are shut, but you present inside this room. My face is down on the carpet. I found a way that fits. I can feel where the wind is. I can feel it through all of the windows inside this room. But I cannot touch you, Robbie, and I wanna feel you too. I wanna see the sunshine and my sins just forgiven. Light it up, oh my love, I'll be up tonight. Wanna make it up for all my wrongs I tried. Never let me be alone. Stay with me from dusk till dawn. Stay with me from dusk till dawn. Robbie, you right, yeah. I'll hold you when things go wrong. Stay with me from dusk till dawn. Stay with me from dusk till dawn. Robbie, you right. Stay with me from dusk till dawn. Robbie, you right. No surprise, the body tears in my eyes. Oh yeah. Hi. I know that you could easily take away everything you've given me, and I try to remember not to take anything for granted, 'cause I know that one day suddenly this will all come to an end. So my last wish is for you to be pleased with me. Allah, ya Allah, guide me all the way to your Jannah. Ya Allah, ya Allah, don't let me go astray, 'cause I need you by my side. I wish to be close to you throughout my life. Ya Allah, oh Allah, be with me all the way. I know that sometimes I do forget that my next breath could be the last. Forgive me, 'cause I can't thank you enough. Forgive me when I doubt your love. Now I pray for that day when all this stops and comes to an end. So my last wish is for you to be pleased with me. Allah, ya Allah, guide me all the way to your Jannah. Ya Allah, ya Allah, don't let me go astray, 'cause I need you by my side. I wish to be close to you throughout my life. Ya Allah, oh Allah, be with me all the way. Day by day passes, and I think that my time could.
Assalamu alaikum and welcome back to the Ruwa Shah Show. We're talking about the coronavirus situation across India and Pakistan and how the situation has changed, particularly after the government's lifting the restrictions partially across both the countries. We have with us Dr. Raad Asad Khan. I hope we can hear you now, Dr. Asad.
Yes, hi. How are
Hi,
you?
Assalamu
I am
alaikum.
Dr. Raj.
Thank you so much for joining us. Dr. Raad Asad Khan is the resident physician in Jinnah Postgraduate Center in Karachi. Dr. Asad, there is an ease in the restrictions across Pakistan, and this is the time when there are over 100,000 cases that are of coronavirus that have been reported. When there were a few hundred cases reported, there was a complete lockdown. How does this make sense?
Yeah, basically, firstly, I'm very pleased to hear regarding the question. Yes, I'm totally agreeing with you. As perfect before easing the lockdown, average cases to us was around 800 to 900 on that time.
Right,
But right now, before the Eid, being the ease in the lockdown, it's around 4,500. So it's very much difficult for our health workers to handle such kind of situation.
right.
And I'm totally agreeing with you on that, that it's not
So
making
you
any
mean that
sense.
it will worsen the situation and there might be a spike in the number of cases.
Yes, as our Prime Minister said it today, around at the end of July, we'll on the peak. And right
Mhm.
now, it's not the peak, but we are daily facing around 4 to 5,000 cases daily. So it's a high time right now to take it seriously.
Mhm. And Dr. Asad, Karachi is the worst hit, and there are most of the cases are recorded in Karachi. And as if I'm not wrong, there are about 60 to 70 ventilators only in the entire city. So, what is the government's response to this? Is the government not prepared to face the situation even at this time when there was a 3 month period to build the infrastructure?
Yeah, you are right. There are only 62 ventilators, and the population of our city right now is the largest city in Pakistan. As far as our population, it's around 16 million, and
Right.
only 62 ventilators are not that enough.
Mhm. Right.
So, and as per as your question, we are provided say 33 ventilators
Hmm.
for our city, and the same amount of ventilators are provided to our capital, Islamabad. So
Right.
it's not enough
It's not enough, right?
ventilator for our population in our city is the congested population we have in our city, and the health structure are not that good. Only a
So it
tertiary
must
care
also
setup.
be affecting the health workers who are there out there, on the front line fighting this pandemic. I mean, a lot of doctors have been tested positive already, mostly in Karachi. And is there any response from the government to provide, efficient system for the healthcare workers, particularly?
Uh, uh, you are totally right. The health care provider are very much on the front line on risk
Mm-hmm.
because, as per his example, 3 days back in Punjab, 721 healthcare provider was affected, and in one day, 159 cases COVID positive was reported to us. So
Mm-hmm.
yes, it's very alarming condition. And today I was in a meeting with my deputy director. So yes, we are now trying to learn from the our mistakes, and we are trying to make it on a small shift basis, that the exposure of the doctor towards the positive patient on the time when they are in the ward or during the duties, our time to expose the patient should be less. So we are
Mm-hmm.
deciding to make it around 4 hours in per shift.
So you think
So
that will
yes, our
reduce the exposure of doctors or other workers to the COVID positive patients, and it will be
yes.
will help to control.
Yeah, basically the PP we are wearing is not that much. It's not easy for us to kept in this PPA for 24 or 12 hours. So yes, for 4 hour proper shift with air seal tight measures, we
Hmm.
can get risk a low risk to get infected. Our exposure is less when we are
Right. Dr.
this
Rad,
way.
there is a drug, particularly, if I pronounce it correctly, it's tocilizumab, if I pronounce
Yes,
it correctly.
tocilizumab. Yes.
Right. This drug is, as per the reports of the Pakistani media, people are consuming this drug in the worst case scenarios, but it is being sold 10 times more of its original price in the black market as of now. So, is this drug being used in your hospital? Do you provide it to the patients?
Uh, in this condition, in COVID, this drug is basically right now in trial 3, not recommended by FDA. This
Mm-hmm.
is basically in class 3 trials. No, till now it's not recommended by FDA to us, but yes, in many public sector hospital or private hospital, it has been used. And previously, we are using it daily in our rheumatology clinics for rheumatoid arthritis, and it was very much it was cost around 19,000
Right.
on that time. Yeah, and you're right. Unfortunately, being a Muslim country,
Mm-hmm.
it has been due to shortage of the drug from the market. It has been sold out in that high prices.
Mm-hmm.
But I am pretty much sure if the supply was provided by the factories to us or pharmaceutical companies, so
Companies, right.
we'll inshallah, yeah, cope up with this shortage.
Right, Dr. Rad, there is, what kind of treatment is being provided to the patients that you get on a daily basis, and how many patients do you get when a patient, for example, a patient feels that he or she is facing the symptoms of the virus, they come to the hospital. Are they immediately being checked? Is the test being done immediately? I think, yeah. I was
Sorry, I
asking.
was just
No, it's
disconnected by
okay.
you.
So, can you hear me now?
Hello,
Yes, can you hear me, Dr. Rad?
hello,
I can hear you. Can you hear me, Dr. Rad? All right,
hello.
we seem
Can
to
you
have some
hear me?
problem. I can hear you, Dr. Rad. Can you? We seem to have some connection issue with Dr. Rad again. Meanwhile, when we try to get him back, so Dr. Rad is telling us about how there has been a huge shortage of ventilators. Only 62 ventilators in a city like Karachi, which is hugely populated. Dr. Rad, can you hear me?
Yes, I'm hearing you right now.
So I was
Sorry, it
asking
was.
you about the patients, when you get a patient in a hospital, for example, somebody, somebody senses the symptoms of this virus. I think there is some really some issue with Dr. Rad's connection, but I'm going to try to wrap up. We got most of the questions answered by Dr. Rad and Dr. Ban earlier in the show. So as the governments have decided to lift the restrictions to rebuild the economy that has been hit severely both in India and Pakistan, that who are very hugely populated countries with very limited resources, not as many resources as the European countries. But this has also led to the surge in the number of cases across both the countries. Now, Dr. Rad was also telling us about how the healthcare system is not efficient in Karachi, which is the most populated city in Pakistan and has a few ventilators, and doctors are being tested positive for the virus, and it has led to a worsening situation. Now, well, we hope that the situation improves, and we get rid of this virus soon from the world. Meanwhile, that is it for tonight, and we'll have you back next Tuesday, same time. Please, meanwhile, you can watch this video and share this from our YouTube and Facebook pages of Salam Media. Thank you so much for joining me tonight. We'll see you next Tuesday. Assalamu alaikum.